Despite many efforts to attempt to slay the graft dragon, the menace continues to be firmly embedded in the fabric of the country, most often than not perpetuated by the same government that is supposed to provide service delivery to taxpayers. The direct impacts of corruption are far-reaching, with the majority of struggling Kenyans bearing the brunt of misappropriation of billions, which ought to see them live a life of dignity. In a country where millions of Kenyans are just a disease away from poverty, millions more cannot access basic healthcare services simply because they cannot afford it. Just like Millicent Awori and David Were, who represent most Kenyans who are struggling to access healthcare.
Nimekuwa mgonjwa sasa ni mwaka 2. Nilikuwa naenda Kenyatta matibabu. Sasa kufika mwezi wa 8 mpaka leo nimeisiwa sina pesa ya kuendelea na matibabu. Na hiyo kitu inanisumbua sana. Hata sasa zingine kupumua ni shida. Hata kukula sasa zingine ni shida kuongea. Sasa naomba tu usaidizi ya fedha niendelee na matibabu Kenyatta.
Hata x-ray nini sasa tulikuwa tumepiga lakini unalipa. Siku hizi hakuna kitu ya bure. Ndio walinipatia dawa, hizo dawa nilitumia ikaisha. So nimekaa tu sasa.
Millicent Awori and David Were have now been forced to wait on hope on their healing at home, despite having frequent visits to Kenyatta and Mbagathi hospitals, respectively.
Kitu inagrow hapa, na tena wanasema inagrow na ndani. Hapa inaonekana tu kidogo kwa umbali. Sasa waliniambia hiyo kitu vile inagrow na ndani, ni mzuri wakifanya matibabu, nikifanya matibabu mapema, inaweza geuka cancer, but wakipima wanasema bado haijageuka, ilikuwa cancer. But waliniambia ikiendelea kugrow hivyo, inaweza geuka cancer, na cancer haina matibabu.
Tatizo niko na shida ya figo. Nilianza kuugua mdogo kuanzia mwezi wa 4. Kuna dawa nilikuwa natumia. So dawa zimeisha. So nimekaa tu.
Corruption and lack of good governance in the country undermines the delivery of quality essential healthcare service in an equitable manner, making it costly for the poor and disadvantaged and results in poor health outcomes. The pain and suffering that Millicent and David are going through comes against a backdrop of sustained effort by the government to bring on board universal health coverage, but ironically, cases of corruption have increased in President Kenyatta's 10-year period, and even so in his second term, when the program was supposed to be deployed. And that's not all. Peterson Wachira, who is the chair of the Kenya Union of Clinical Officers, says corruption is a double-edged sword that affects both service providers and service seekers.
Corruption denies any population their right to health, and in that whatever was supposed to be channeled to make the health system better, to be able to address the needs of a population, is then consumed by selfish people, and then the people are left suffering.
Health is among the socio-economic rights guaranteed for Kenyans in Article 43 of the Constitution, although that seems to be unattainable for Millicent and David.
Mwili nimechoka kabisa. Alafu hiyo kitu inaniuma. Imeshika macho, masikio. Kitu inaniuma non-stop, hata nikimeza dawa. Niwezi stop hata saa hii.
Hiyo kadi nilikuwa nayo, kuna wakati nilikuwa nafanya kazi na tulisimamishwa. So from there mpaka now sijalipa.
How they are going to ensure that they improve the budget for health, as we as a country signed in the Abuja Declaration, towards 15%, so that then we can be able to create better institutions which are effective, we can be able to improve staffing, we can ensure we have drugs in the hospitals, because we have a very meager budget. But even this budget corruption steals part of it. So you cannot be able to stock those drugs in a facility. That is why when you go to a public facility, you'll be sent to an outside chemist to go and buy drugs. And it's not a problem of health workers.
Millicent has a pending surgery that she cannot afford, and Were is in dire need of dialysis. They need help because of their inability to work and get money for the treatment.
Wanisaidie niende Kenyatta niendelee na matibabu Kenyatta, ili niweze kupona nirudi kwa kazi yangu, nisaidie watoto bila nilikuwa nawasaidia kitambo. Sasa hivi sina pesa. Sasa siwezi endelea na matibabu. Juu sina pesa. Sasa nimekosa tu pesa ya kuenda matibabu peke yake.
Kujaribu wamejaribu. Sasa wamejaribu. Ni vile tu sema mimi activity yangu. Sijalipa totally sababu vile nilisimamishwa kazi sijalipa tena. Lakini kadi niko nayo.
Wachira says it is never too late and the health sector can be salvaged if a well-set plan by the government is carried out.
Understanding the core mandate of health as an enabler of any economy, we are doing 4%. And so in the manifestos, we have been asking them, can you guarantee Kenyans that you are going to improve to 15% so that we can have a healthier nation? For example, lack of an ultrasound machine or an X-ray machine. What does it mean to the common Kenyan? It means that cancer that would have been picked in your nearest hospital and cured when it's still in stage 1, when it can be resected or removed completely and you're cured, you'll only come to know of it when probably it's in the later stages which cannot be cured.
As the country continues to grapple with hard economic times, the health sector is equally affected. A good example is David Were and Millicent Awor, who cannot afford to pay for their hospital bills due to hard economic times. They are saying the government has to do more in order to cater for its citizens. For Ebru TV, I'm Kaindo Stefano.